Hello, everyone. My name is Elizabeth Keys, and I am a member of the Leader in All of Us organizing committee. I'm also a two-time alumni and adjunct clinical associate with Calgary Nursing. For this afternoon, I'm actually coming to you from the beautiful city of Halifax, and I'd like to begin by acknowledging my physical location, which is located in the Mi'kma'ki, which is the ancestral and unceded territory of the Mi'kmaq. And that a reminder that we are all treaty people. And I think this last statement's particularly relevant in this virtual environment because it speaks to the need that we all must play a role in reconciliation and wherever our physical location is, which is quite important in these virtual conferences. I'm very pleased to be your moderator for our next panel on Leading Beyond Borders, Leadership in Community and International Settings, with three amazing panelists, Louise Baptiste, Dr. Cheedy Jaja, and Dr. Zahra Shajani. They will offer their perspectives on leading beyond borders. After we hear from each of them, we will come together again for questions and discussion. Remember that the chat is open and you can enter your questions or comments there while the video is playing or during the chat or discussion period. As a reminder, we're going to have a draw for 2 pairs of Vessi shoes. So it's important to make sure your full name is displayed in the chat, and you can message Amber, our amazing host, and she will change it for you. So with that, we'll leave it to start the videos.
Hello. Oki Tansi, my name is Louise Baptiste and my Cree name is Iskotea Squayo. I am First Nations and a member of Samson Cree Nation from the Muscogees community located just outside Edmonton. I have been a nurse for over 17 years and I have worked as a nurse educator for about 11 years now. I completed my Master's of Education degree with a focus on community and adult educational research, and I'm currently finishing up a Doctorate of Education research degree focused on Indigenous language and literacy. I have worked in emergency, mental health, geriatric, postpartum, and surgical areas over the years. Prior to coming to work as the Director of Indigenous Initiatives with the Faculty of Nursing at U of C, I work for the Indigenous Health Team as a cultural safety educator. I have worked in a variety of leadership roles in nursing education over the years. I worked as a clinical coordinator and led regional nursing programs for Bow Valley College. And one of those programs that I led was a nursing healthcare aid program at Old Sun Community College in Siksika. I also worked with the Cont Ed team as a director at Bow Valley College. For the past 3 years, I have served on the Calgary Police Services Indigenous Advisory Board. I've also served with Karna's Indigenous Advisory Board and a number of other community boards and committees, both at UOC and within the city of Calgary. Until 2015, my leadership roles were primarily focused on nursing education and practice. However, in February 2015, my focus changed to taking on a leadership role within the healthcare system for Indigenous peoples. This occurred primarily due to a personal experience. In 2014, my sister had asked me to take in her children due to her being in an abusive relationship. I ended up having her children for longer than originally planned, as she was murdered in 2015. It was during that time that I became more cognizant of how the healthcare system, the social work system, and the justice systems had policies in place that discriminated against Indigenous people or made it difficult for Indigenous people to access resources within the community. An example of this was when I took my late sister's children to be seen by a dentist. Social services refused to cover them, even though all children should be covered under social services while they're in care. but they refused to cover them because they should have been able to access non-insured health benefit through having Indian status. However, the children did not have Indian status due to their father refusing to sign their birth certificate. So I ended up having to cover their dentist bills, despite having 5 children of my own to support. Later on, I did obtain Indian status for them after going through several channels, but then at that time it was difficult to find a dentist that would take non-insured health benefit. So this is, you know, one of numerous examples I could give you of how the system, you know, policies make it difficult for Indigenous people. Another example, which led me to work with Calgary Police Services, was how my sister was portrayed by the media in a picture that was provided to them by the police. Despite family provision of photos of late Dawn's, the police released a photo of her to the media after she was assaulted by her abusive partner prior to her death. She was quite bruised and swollen in this photo, and she was portrayed in the media as being known to the police, despite only being known because she was a victim of abuse. I felt I had a responsibility as an Indigenous mother, an auntie, and a community member to start doing more work towards positive change within the community. I had experienced discrimination within the healthcare system and systemic discrimination throughout my life. However, I saw people within my own community suffering to far greater extent that had led to death within these systems. Listening to the stories of my mother and her siblings and her mother, all their experiences in residential school, had also emphasized that our educational systems required change. Even though I had skipped 2 grades in school, I ended up dropping out at the age of 15 in grade 11 due to not having family support or a home. I dropped out of necessity. Later on, I was able to go back to Montreal and take a Bachelor of Arts degree. But I never saw going to school as a means of becoming a leader, gaining a career, or being an advocate. I saw going to school as a means of survival. It was a way to support my family. However, through the work that I have done in the past 6 years, advocating for Indigenous peoples, it has led me to being considered as a leader within my own community. So what does it mean to be a leader? So I'm going to discuss first what we see as leaders within the Indigenous community. So in the Indigenous community, we have elected leaders that were put in place through the Indian Act. However, our true community leaders are our elders. Elders are people recognized in their community as having gained in-depth expert knowledge of the traditions, cultures, teachings, ceremonies, language, or other aspects of their nation, and by consensus of the community are allowed to pass on that knowledge. Typically, our elders are generally older, and I have never thought of myself, as an elder or a leader in that sense, but I have been recognized by my own community for the work that I do. For me, to be a leader means to lead holistically, meaning it's not about power, but more about relationships and being true to what your calling is spiritually, emotionally, mentally, and physically, and making sure that these 4 components are balanced in order for you to be effective in this role. I have struggled with this due to unexpected health events and things that have impacted my family in the past few years. The only thing that has kept me going is my relationship to my community and my relationship with Creator, and resilience, which is the capacity to recover quickly from difficulties, toughness, and overcoming adversity. For me, I'm going to give you 4 takeaways that I have about leadership and being a leader. One is that you know your limitations and strengths. Leadership is more about seeing what needs to be done and knowing what you have the capacity to do. My second takeaway is leadership is communal, meaning when you're in this type of role, you should be working to amplify the needs of the community. But communal also means you can accomplish far more with a group of people with diverse ideas and strengths rather than with just one person. So it should be communal. Leadership should be, my third takeaway, leadership should be innovative, meaning don't take no for an answer. Rather ask why. Ask why barriers might be in place. What can we do to work within those barriers or remove those barriers? Innovation. Last takeaway, leadership should be strengths-based. Look for the strengths in others rather than the weaknesses. Don't expect people to be something they are not. Rather motivate them based on the good that you see in them, the strengths that you see in them, and utilize those strengths. So those are my 4 takeaways, and I want to thank you for listening, and I am excited to hear from you.
Hello, my name is Cheedy Jaja. I'm an associate professor of nursing at the University of South Carolina in Columbia, South Carolina. The title of my talk is Guiding Principles for Providing Competent Nursing Leadership During Disease Outbreak, a personal story. I have no potential conflict of interest or financial interest to disclose. The agenda for my talk is as follows. I'm going to share my experience providing care for patients with Ebola virus disease that occurred in 2014 to 2016 in the West African country of Sierra Leone. I'm going to discuss the leadership principles and values that I acquired from that experience. And I'm going to end by discussing lessons learned from the experience and the application of those lessons to the current COVID-19 pandemic. So in 2014, 2016, 3 countries in West Africa, Liberia, Sierra Leone, and Guinea, experienced an Ebola virus disease outbreak that can best be described as a complex humanitarian emergency. Now, a complex humanitarian emergency is a situation whereby the crisis or the disaster is of such a magnitude that the resources of that country is not sufficient to address the occurrence, the pandemic, or the disease outbreak. And that was what occurred in West Africa in 2014. And these countries had to call on the rest of the world for help and relief. And I was one of several nurse clinicians from all over the world who showed up in Sierra Leone to provide help. And what you can see on the slide, are images that I can refer to as the dark side of Ebola. And these are my experience firsthand. Ebola does not discriminate. It impacted or affected both adults and children. Also, during the time of Ebola, it was also a time of grief, doom, and gloom, because almost every aspect of society in Sierra Leone was impacted by this virus. And also the disease itself did not, well, it basically upended traditional values. So for example, when somebody died from Ebola, there ain't any traditional ceremony or formal ceremony to say goodbye to the dead. You die from Ebola, it's straight to the cemetery. And again, as we're currently experiencing here in the West, with the COVID-19 situation, during Ebola, society literally grind to a halt. Also, the businesses, schools shut down, and expatriates, went back home. And so Ebola was the main activity, in town. So the question now becomes, why did I get involved in the Ebola relief effort? The answer to that question is really simple, though. Nurses have a proven track record of involvement and commitment and leadership in times of disaster and crisis, as we're currently observing with the COVID-19 situation as well. But I think the important question is, what principles and values compel nurses to be at the front line, to do what they do? And so that's going to be the focus of this talk. In my experience with Ebola, I was able to identify 8 principles that I think are essential in nurses who are involved in global health work, global health mission, and who are also involved in disaster or pandemic situation. And these are the principles of deference, intellect, compassion, steadfastness, humanism, proactive, resilience, and duty. Okay. So I'm going to try to talk through some of these principles. So this is me in the Ebola hospital. What I did in Sierra Leone was basically 2 things. As a psych and mental health nurse practitioner, I provided direct patient care to folks afflicted with Ebola. But I actually ended up doing 2 tours of duty, okay? And during my second tour of duty, I assumed leadership position. I was leading 2 frontline Ebola hospitals. But typically, this is how we would dress in the Ebola hospital. But who would want to dress like this? Who would like to be in a body armor to go interact with patients? So for me, it was a sense of duty, that motivate nurses, to put themselves in the situation, to dress like this, put themselves in a situation where they have a higher risk to contact the disease. Okay. So nurses are motivated by a sense of duty to work in very difficult and trying circumstances. Okay. Intellect, I believe, is very important, especially when you have a leadership role like I did. So this is a picture of what an Ebola hospital looks from the air. And I found that you need to have intellect because it's very crucial for leadership. In the Ebola hospital, your nurses, your staff look up to you. So you need to have those qualities to provide guidance and direction. You need to have those qualities that enables you to delegate roles and responsibility. But more importantly, you need to have that demeanor whereby you exude confidence, and as such, you're able to motivate your staff to do the task at hand. And I think for me, the important ingredient for that is having the right intellect. Compassion and humanism are 2 nursing values. What do I mean by this? I think as nurses, when we provide care, we should all be mindful, that we could be at the opposite end, that we could be patient ourselves. So with that realization, when we provide care, we should do so with compassion. We should do so with empathy. We should do so with the understanding that we're providing the best care, the care to the best of our ability, and is the kind of care that we're providing is the kind of care that we would like to receive ourselves if we were patient. And I think compassion and humanism embodies those 2 values. So this year with the COVID-19 pandemic, I've been looking back on my experience with Ebola to see what role I could play in terms of advocating for the interests of nurses. Okay. Because of my experience with Ebola, I saw firsthand that nurses need support. They need a lot of support. If not, you know, the mere experience of working in an epidemic or pandemic situation can result in trauma and pain. And I experienced all of that. So in my advocacy work, the question that I ask is, did I have the appropriate nursing preparedness required in a disease epidemic? And for me, the answer to that question is no. Okay? And I think because it's no, if you ask most of the nurses on the front line today, I think the answer is also going to be no. And why is the answer no? Okay. Well, I think the issue relates to two conflicting duties that we as nurses have. Okay. As nurses, we have a duty to care for society, but we also have a duty to self. And I think we have not done a good job balancing those two conflicting ethical duties. And I think what we need is a focus on nursing preparedness. So nursing preparedness is a set of skills, abilities, and knowledge that enables nurses to respond and prepare for varying public health emergency roles. Okay. And so what this entails is that the institution for which nurses work have an obligation to make sure that they equip the nurses with all the resources, the requisite training that they need to do a good job. But it also requires nurses to embody a number of principles. And for me, I've outlined 4 principles that nurses needs to embody. That's essential for them to be able to balance, you know, these two ethical duty to care for society and duty to care for self. And in my experience, I think being proactive, expressing deference, displaying steadfastness, and showing resilience are 4 essential principles. So what do I mean by proactive? Well, in the front line, you need to always be thinking ahead. What's going to be your next move? What's going to be your next step? You know, you cannot afford to be reactive. You cannot be reacting to the situation on the ground. You need to be one step ahead. You also need to be steadfast. In pandemic situation, epidemic situation, you're going to encounter a lot of negative experience, a lot of negative encounters. So for example, in the Ebola hospital, every day it's not a question of who is going to die, it's how many people are going to die. And so what you have to do is you just need to be steadfast. You're going to say, okay, I'm going to go in and, you know, do the best I can to give with my talent and capability. I'm not going to think, you know, beyond that. Okay. You also need to be resilient. You also need to be resilient in the sense that you might not have all the resources that you need. You might not already have the resources, you know, that you need. So you need to be ingenious. You need to be able to make you do with whatever little you have. In the Ebola hospital, we were constantly dealing with dwindling medical resources. Supply was always short, and treatment protocols were constantly changing. So we had to go with the flow. We had to be ingenious. We had to be innovative. And so that's what resilience means. And then finally, you need to be able to express deference. Deference, the way I look at it, is that you need to be able to pause and laugh at yourself and situation around you. You cannot all constantly be serious all the time. So for example, if you're in the Ebola hospital, if you're able to get a kid, to drink, a glass of water, that is an accomplishment. If you could able to cajole your patient to eat, that is an accomplishment. I found out that, manifesting these four principles were very important, for my everyday, work in the Ebola hospital. I think adopting this principle will take you a step toward being able to balance the nursing duty to care and the nursing duty to self. And I say that because this photograph on the left-hand side is very iconic. It's iconic in the sense that these were nurses in Sierra Leone who were at the forefront of the Ebola outbreak. And each nurse in this photograph died. And I think that they died doing what nurses do, and that is providing care for their patients. But we don't want that to happen to our nurses, so we want our nurses to be able to balance the duty to care and also the duty to self. And adopting, the appropriate principles, I think, put us in a good direction, in that sense. Okay. So this is my final slide. I want to say one thing though. If you have lemons, make lemonade. Okay, so what do I mean by that? I went to Sierra Leone solely to provide help for patients with Ebola virus disease. And I came out of Sierra Leone acquiring a new purpose, a new sense of mission. By that, I mean that over the last 3 years, I've been involved in global health mission in Sierra Leone, building a health system and capacity for sickle cell disease, which is my area of clinical work and research. And so this picture that you see are some of the kids that I've been working with, post-Ebola. And part of the reason why you see I'm smiling like this, is because in a way I have found my mission and my purpose, and which is, to provide care for kids with sickle cell disease. And as such, I'm very happy. So if you have lemons, make lemonade. Thank you very much.
Hello everyone, my name is Zahra Shajani. I'm the Undergraduate Associate Dean for Practice Education at the University of Calgary, Faculty of Nursing. In this role, I can leave my mark as a leader by influencing the nursing practice. I don't take this role lightly as I balance passion and values in an ever-changing education and health environment. And much of what I have learned in meeting these challenges have come from my community work and my background, some of which I will share with you today. I started my nursing career in my early 20s in an acute care medical unit at the Foothills Hospital. I later moved into a postpartum unit and found a passion in working with families, especially with mothers and babies. This is perhaps the first time in my profession that I found that I could make a significant impact on someone's life, and it felt good. I knew since I was a little girl that I wanted to make a difference in people's lives and give back to my community. I just didn't know what I would have that would be of value. I was born into poverty in a low-income African community. My first years were spent in Dar es Salaam, Tanzania, playing on dirt roads, making my way to school, and just being a kid. That was my world. I thought I had so much, yet I didn't realize this is what the West would consider as poverty. My parents sent me away. They sent me to Canada for an education and away from the dangers of poverty. I grew up with my aunt and uncle. I knew how lucky I was as a girl to have an opportunity to be educated. And one day I wanted to give back to those who did not have the same opportunities that were being presented to me. People say perspective is important. As a child, I never felt poor. I remember telling my husband about the house I grew up in Tanzania and how big it was. He went to visit my hometown and my parents before we were married. He didn't disagree with my perception of my home. He was convinced it was filled with love and sacrifice. After all, who would give up precious years with their child just so that they could have a chance at a better education? When I had my daughter, I went back to visit my biological parents at the home in Dar es Salaam. I was shocked. The pictures and the images of my childhood that I had created in my head were nothing like the realities of the home and the neighborhood that I had returned to. This is when I truly understood the reason my parents sent me away. Words can't describe what I saw. When I returned from that trip, I reflected on my experience, and the need to make a difference in people's life was rekindled inside me. I started with volunteering my time and sharing my knowledge. As a member of it for early childhood development on the Aga Khan Education Board for Canada, I was the national lead for early childhood program and led a group of people in delivering this program in 5 Canadian regions with 26 centers with over 100 volunteers working to give parents access to quality early childhood education. I got an opportunity to develop online training modules focusing on areas of brain development and attachment for potential facilitators who were early childhood educators in Canada. And then I shared and taught these materials to facilitators in Australia, New Zealand, South Africa, and East Africa. This journey has taught me that whatever you do, you must have a purpose that is driven by your passion. Undertaking a leadership role can be daunting and challenging, but leaders exist everywhere. What makes an exemplary leader? People who follow their passion, inspire others. They model their behavior to demonstrate what they expect from others. Those leaders find meaning in their work that inspires others. Inspiring others makes an extraordinary leader. I found my inspiration from the relationships around me, a passion to have a significant impact on someone's life, be it on their health, education, or just providing hope. I have learned that leadership is not about privilege and power. Leadership requires reflecting within yourself, the ability to listen to others and be reflective and adaptable in uncertainties, and bringing in calmness during chaos. Finding strength in each other and moving beyond the ordinary to extraordinary. We are in a world of constant change, volatility with uncertainties, complexities, and ambiguity. Our world and societies are constantly changing. What can we do? The flood here in Calgary in 2013 was an immediate change in the landscape of this city. Many leaders came forward to help their neighbors. I had been a nurse educator at the time at the University of Calgary for a few years now and was tasked in providing a needs assessment for the displaced families. But we took this challenge and looked further. There was clearly a need for help. So we put out a call to our students and opened up the residency at the university, coordinated a makeshift health and resource center and included emotional support. We had over 100 students and faculty answer to that call, and together we provided support to over hundreds of families that were displaced. This story was made possible because of the initial needs assessment, a process that required listening to others. We were then reflective and adaptable to the changing environment. We pulled resources and did the research to bring some calmness during the chaos. You will find that when you are honest, kind, responsible, generous, respectful, and give back to your community, good things happen. You're stronger when you are empowered and when you inspire others. This will be the influence you will need to enlist the help of others, because you cannot do it alone. It is easy to break if you're alone. As a wise person has said once, one stick can be broken easily, but many sticks together are difficult to break. Help others and hope that they will be there for you when you need their help. Barack Obama had said, think about what you can do, not what you want to be. He has urged leaders to consider the concept of purpose rather than the quest for fancy titles. When I have volunteered with titles of director and chairman in demanding roles, I have found certainly the attempt to do it alone, but it has been difficult. So much more can be accomplished with the right team. And what is a leader without a team? Leaders have a responsibility to develop their team. When we can help the people on our team tap into their best selves, we're helping them from a sense of purpose. We can achieve considerable gains when we are centered on inclusiveness. Don't underestimate your influence on developing the values of others. A good leader will impact their society, and we cannot lose sight of being a value-based society. It was also Barack Obama who said, values will get you through hard times and good times. They are the things that give meaning and purpose to what we do. Organizations need to help people become better performers with what is in their hearts. And I will tell you that if you live your values, this will bring forth your passion, and that will allow you to inspire others. And to inspire, you must also listen and reflect and be adaptable with the circumstances as they change. And as you inspire others, your influence will grow to allow you to impact many lives and to leave your mark as a leader. Thank you for letting me share my story, and I can't wait to hear yours.
Hello, everyone. Coming back again, thank you to Louise, Cheedy, and Zahra for taking the time to join us today. Just a reminder for Louise, Cheedy, and Zahra to unmute and yourself and turn your video on so we can join the panel. We did have a question in the chat that I caught. Oh, and there's been so many comments. I'm just trying to scroll back through it. I believe it was from Lorelei, and it's just an open question. So wondering if you each could share about how your values have changed throughout your various leadership roles. Zahra, maybe you could go first.
Sure, that's a loaded question. I think that your values, just your experiences shape your value, but you know, values are embedded as you experience things. And so as I have experienced with my work, with my community work, raising a family, you know, my core values haven't changed, but the experiences have shaped me to be able to respond in ways that my values have come in to be able to be responsive in that way. So I don't know if my values have changed, but the experiences definitely do make you understand your values a bit better.
And Louise or Cheedy, would you care to have a thought?
I think for me, what has changed is a renewed sense of humility. We've all talked about different values that motivate us, that guide us, that inspire us in its different situations that we interact. But life itself is dynamic. Life itself is constantly changing. So I mentioned humility in the sense that
with life, it doesn't matter what you know, how much you have, you're constantly going to encounter new, novel and challenging situation. So you need to be aware that every day itself is a learning experience. So humility is important because that's what makes you grow on a daily basis. So I didn't mention humility as part of my presentation, but I think, based on what I've done to date, I've learned to be very humble. I've learned to have an open mind, to be very receptive to situations I find myself in.
Thanks, Cheedy. I will add to, I agree about humility and that values, actually, I don't believe values necessarily change. It's more being true to who you are. And I think for myself on my journey, that's what I have moved more towards, because in the beginning of my journey, I was, following what I was basically taught more so than what I felt was true to my heritage, my culture, ethnicity, and how I grew up. And so I felt like those values have now come more into play recently.
Great, thank you. And what do you guys, I mean, everybody, you've described these really rich and meaningful experiences that you've had, sometimes filled with hardship. How much do you think that that has influenced or changed how you perceive what leadership is? And then to build on that, how much do you think that nurses need to have similar experiences to the people that they're leading? Maybe Louise, you could take a crack at that one first. We'll go clockwise.
I feel that it does help with empathy. If you can place yourself into what we say in our culture, another person's moccasins or shoes. So having, hardship and also being resilient to that hardship can help you. I think not only for others to see that and see that you're true and genuine, authentic, and that you're able to, share those stories even with your patients, with your students, so that they can see, I mean, everybody's going through something, everybody has a story, and sometimes hearing your story can help them to say, okay, I'm not the only person that's going through this. And so I feel like that those, experiences and hardships actually have helped myself anyways.
Cheedy or Zahra, would you care to comment?
Yes, so the word resilience, have come up so many times today. And I think it's a very important principle, mainly because it's what allows you to continue to evaluate yourself. Resilience is what allows you to continue to learn and you grow on the job. Louise, in a presentation, mentioned that as a leader, you need to be an innovator. You need to be able to draw on the strength, of yourself and the strength of your team. And I think resilience is what actually enables you to capture, those values. Resilience is what helps you to be innovative, to make do with very little resources that you might have in a certain setting. Resilience is what makes you become very creative with whatever little you have. And also resilience also allows you, based on how situation occur, for you to laugh at yourself, but for you to also be joyful, in just doing very, ordinary things, I mean, I remember when I was in the Ebola hospital, okay, just to get a little kid, to drink water, itself was an accomplishment, okay. So resilience is what makes you to be able, to be innovative in whatever circumstance you find yourself, but to take joy in what you do.
I can pick it up from there. I think I completely agree with both the speakers in terms of resiliency, passion, looking at within yourself, your inner strengths. You know, when you work with your strengths, you can get way further and develop those areas that aren't as strong because you're working on what you have in your toolbox. So really looking within yourself, your inner strength, being resilient, learning from experiences. Everybody makes mistakes. We are not perfect. And I think it's learning through those experiences. For myself, the hardest period has been during leading is when I'm not certain. You are presented in a situation that you've never been in. And there's so much uncertainty, ambiguity, and it makes you very volatile, right? And makes you kind of, thinking about flexibility and being adaptable, but really just reaching in, looking within yourself and understanding what your strengths are, that can definitely lead you in the right direction. And then taking people with you. Never try to do it alone. As I mentioned in my message, if you do it alone, it will break you. So find people that have common values, or bring the commonality, shared values, shared vision, and shared strengths, or tap on each other's strengths, because if whatever I don't have, somebody in my team will have, and they will fill that gap. So, one of my things that I talk about is, everybody holds a piece of a puzzle, and everybody brings that puzzle to the table, and together we make a whole picture.
Thank you. We have a question from Stephanie. She says, usually innovation is tied to technology. Do you think there are innovations that come from compassion?
I think I can answer that. When I think of innovation, I don't always think of technology. I also think of things like usually innovation is a new method, right? It can be a new method, product, or whatever, however you want to label it. But for me, innovation could be a new way of looking at things. So for example, at the UOC with their Indigenous strategy, right? And looking at ways of doing research differently, or incorporating different ways of knowing into practice and research. And so I do think that it's not always about technology, but also, so meaning compassion in that sense is understanding, or trying to understand others and their ways of knowing and thinking, and how they might view something differently. And when Zahra was talking about drawing on the strengths of others, I think that's part of it too.
I can talk about compassion until the cows come home, because I think as nurses, compassion is what draws us into the profession to begin with. I mean, I'm yet to see a nurse who is not compassionate. Okay. I think that will be an oxymoron. Okay. But compassion, more importantly, is what gives meaning to what we do. Okay. And also is what gets us as nurses into trouble. I say that in the sense that as nurses, we tend to see ourselves as superhuman. We don't want to give up, So in our clinical encounter or encounter with patient in different settings, we want to go beyond the call of duty. And it's that compassion that continues to drive us. But again, compassion is what shows our true character. Compassion is what compels us to be human as nurses.
The beauty of being last, I get to agree with both of my panelists. I think building on what they have said, compassion is absolutely the foundation of nursing. It's our relational communication we build in as the beginning stages of what we teach our students, but compassion starts at a very early age when you're taught how to share, how to be kind, And there are so many things that build on that since your early childhood. And this is why I'm so passionate about early childhood. Innovation definitely comes from compassion as well. Again, defining that definition of innovation is very, very important. Everybody will define it differently. Everyone will see it differently. And so, you know, when you're thinking about compassion and innovation, I see it as, you know, it definitely can come and they're both aligned.
Thank you. And we probably just have one more minute. So I'm just wondering, for some of our emerging leaders, what would be one thing that you recommend they do to get more, if they want to become a leader in the community or in the global health setting? Cheedy, would you mind? You're up.
I would say do your homework, learn about the people, learn about their culture, the people you're going to work with, have an open mind, appreciate the fact that in everyday encounter, you're learning and growing at the same time.
Wonderful. And Louise or Zahra, do you have any one-step directions?
I feel like I'm going to repeat myself, but just find your passion and then align yourself with people that have the same passion and values as yourself, and work together to move all of you together forward. So find your passion, find your mentor that shares the same passion as you, and align that, and then move forward together.
I agree with both speakers about, you know, our emerging leaders finding, you know, your passion is huge. And not only finding your passion, but being true to yourself and who you are.
Thank you so much. And thank you again just to all of you, Louise, Cheedy, and Zahra, for taking the time to join us today. I think you've shown us such breadth in the ways that we can be leaders within our communities and beyond our borders. And I was just struck by, you know, not only the opportunities for nurses to lead within community and global settings, thinking about learning about leadership from different and more diverse ways of thinking, but also really opportunities to lead and make meaningful impact by acting on your passion, which, you know, really wraps up what you just said. You've all done such amazing things, and you know, I think that, but also given us some really tangible foods for thought about how each of us, no matter our stage in nursing, can lead. So thank you very much to all of you for joining us today.